official presentation of the PS baby powders to National Association of Nigerian Nurses and Midwives by our amiable, because she's a comrade today. She's among the comrades. She's the grand manager of Unilever Nig Plc, and she's presenting to us 11,088 cartons, cases of PS baby powder today, 16th of July 2020. We all know that this period is a period when the world is faced with pandemic COVID-19. And Unilever Nig Plc feel it's important for them to also join the world to give relief materials to new moms and expectant mothers in all the MCC, that is maternal and child health centers, and all the hospitals in Lagos State. And it's so amazing for us to get this magnitude of products, baby powder, worth millions. Working relationship with the association and the Lagos State government have been cordial. The government have been proactive in their doings. However, there are a lot of challenges that nurses and other health workers are facing. The issue of PPE is still a challenge, and we want to appeal to the government to ensure that the PPE issue, we want to appeal to Lagos State government to supply more PPE to various hospitals in the state so as to prevent the infection and reinfection of nurses and other health workers in the system. Many of our members are positive to COVID as a result of inadequate PPE. And if this PPE are provided, at least it will reduce the level of exposure of our members to the COVID, and the transmission rate will also reduce. And if health workers, if there are reduction in the exposure rate and contraction rate of COVID, automatically there will be reduction in the community and Lagos State as a whole. We also have the challenge of taxation. Many of our members are paying huge amount of money on tax monthly. For example, a level 15 officer in the state is paying over 60,000 monthly on tax, and level 17 officer is paying over 70,000. This is eating into the salary of these nurses in the state, and I think the government needs to do something about the tax issue. Another challenge is shortage of staff. Our members, because of the increased rate of COVID in the system, nurses and other health workers are overworked. They are overwhelmed with the care of the patient. So government needs to employ more nurses and other health workers. The increasing rate of COVID in Lagos State is devastating. It's not encouraging the health workers at all. And the issue is as a result of the public not adhering to the preventive and protective measures that will ensure that we curtail and eradicate this virus. The issue of social distancing and physical distancing is no longer taken seriously by the public. The issue of hand hygiene, environmental hygiene need to be looked into. And the use of masks must not be ignored by the public. This should be enforced by the government to ensure that we eradicate this virus in no time. I want to advise that we maintain physical distancing. Social distancing is also very important. Use of face masks is very, very important. And we should educate ourselves on hand hygiene, use of alcohol-based sanitizer, and also personal and environmental hygiene is very, very important.